Osteophytes, often called bone spurs, are bony growths that develop along the edges of bones. Imagine them as small, extra pieces of bone that stick out from the smooth surface. While they might sound alarming, osteophytes are often the body's way of trying to repair itself. These bony projections typically form in response to damage, pressure, or stress on the joints. As we age or experience joint injuries, the cartilage that cushions our bones can wear down. Osteophytes may develop as the body attempts to stabilize the joint and restrict movement in the affected area. One of the most common causes of osteophytes is the natural aging process. Over time, the cartilage that cushions our joints gradually wears down. This wear and tear can trigger the body's repair mechanisms, leading to the formation of osteophytes. As we age, our bodies also produce less synovial fluid, the lubricating fluid that helps our joints move smoothly. This reduced lubrication can contribute to friction and inflammation, further increasing the risk of bone spur development. Think of it like the tires on a car. With age and use, the tread wears down. Similarly, our joints experience wear and tear over a lifetime. Osteophytes are like the body's attempt to compensate for this wear. Arthritis, particularly osteoarthritis, is a major contributor to osteophyte development and joint degeneration. Osteoarthritis is a degenerative joint disease that causes the progressive breakdown of cartilage. As the cartilage deteriorates, the bones rub against each other, leading to significant pain, stiffness, and inflammation. In response to this damage, the body may try to repair the joint by forming osteophytes, or bone spurs. However, these bony growths can sometimes worsen symptoms by further restricting movement and irritating surrounding tissues. Other types of arthritis, such as rheumatoid arthritis and psoriatic arthritis, can also contribute to osteophyte formation due to chronic inflammation and joint damage over time. Osteophytes themselves don't always cause symptoms. In fact, many people have bone spurs and are completely unaware of their presence. Symptoms typically arise when osteophytes rub against other bones, nerves, or tendons, causing irritation and inflammation. Common symptoms of osteophytes include pain, stiffness, and limited range of motion in the affected joint. The pain may worsen with activity and improve with rest. Some people may also experience swelling, tenderness, or a grinding sensation when moving the joint. The specific symptoms can vary depending on the location and size of the osteophytes. For example, bone spurs in the spine can cause neck pain, back pain, or radiating pain down the arms or legs. Section 5. Osteophytes and nerve impingement. In some cases, osteophytes can compress nearby nerves, leading to a condition called nerve impingement. Nerve impingement can cause a range of symptoms, including tingling or numbness, weakness, muscle spasms, and shooting pain. For instance, if an osteophyte in the neck compresses a nerve in the spinal cord, it can lead to pain, numbness, and weakness that radiates down the arm. This condition is known as cervical radiculopathy. Similarly, osteophytes in the lower back can compress nerves that travel to the legs, causing pain, numbness, or weakness in the legs and feet. This condition is known as lumbar radiculopathy. Section 6. Diagnosing osteophytes. A look at the tools. Diagnosing osteophytes typically involves a combination of medical history, physical examination, and imaging tests. The process begins with a thorough review of the patient's medical history to understand any underlying conditions or previous injuries that might contribute to the development of osteophytes. During the physical exam, your doctor will assess your range of motion, check for tenderness, and listen for any grinding or clicking sounds in the affected joint. This hands-on evaluation helps in identifying the physical manifestations of osteophytes. Imaging tests, such as X-rays, are essential for visualizing osteophytes. These tests provide a clear picture of the bone structure and can reveal the presence of bone spurs. X-rays can show the location, size, and shape of bone spurs. This information is crucial for determining the extent of the condition and planning appropriate treatment. In some cases, your doctor may order additional imaging tests, such as magnetic resonance imaging or MRI. MRIs are particularly useful for getting a more detailed view of the affected area. MRIs use magnetic fields and radio waves to create detailed images of bones, soft tissues, and nerves. This advanced imaging technique can provide a comprehensive view of the joint and surrounding tissues. They can help identify nerve impingement or other complications caused by osteophytes. This is particularly important for diagnosing issues that might not be visible on X-rays alone. Computed tomography, or CT scans, combine X-rays from different angles to create cross-sectional images of bones. These scans offer a more detailed and layered view of the bone structure. They can provide more detailed information about the shape and size of osteophytes, especially in complex cases. This level of detail is invaluable for planning surgical interventions if needed. These imaging tests allow healthcare providers to pinpoint the location and severity of osteophyte growth, guiding treatment decisions. By combining these diagnostic tools, doctors can develop a comprehensive treatment plan tailored to the patient's specific needs. Section 7. Conservative treatment options, managing pain and inflammation. The initial approach to treating osteophytes often involves conservative, non-surgical methods aimed at relieving pain, reducing inflammation, and improving joint function. These conservative treatment options may include medications over-the-counter pain relievers, such as acetaminophen or ibuprofen, can help reduce pain and inflammation. In some cases, your doctor may prescribe stronger pain medications or corticosteroid injections to provide more targeted relief. Physical therapy. A physical therapist can teach you exercises to strengthen the muscles around the affected joint, improve flexibility, and increase range of motion. They may also use modalities like heat, ice, or ultrasound to manage pain and inflammation. These conservative measures can effectively manage symptoms and improve quality of life for many individuals with osteophytes. Section 8. Physical therapy and lifestyle modifications. In addition to traditional physical therapy exercises, incorporating low-impact activities into your routine can be beneficial. Swimming, cycling, and walking are all excellent options that put minimal stress on the joints while promoting strength and flexibility. Maintaining a healthy weight is crucial, as excess weight can put added stress on weight-bearing joints, exacerbating osteophyte-related pain. Losing even a small amount of weight can significantly reduce joint stress and improve mobility. Furthermore, assistive devices such as canes, walkers, or braces can provide additional support and stability, making it easier to stay active and independent. Section 9. Surgical interventions. When other options are exhausted. Surgery is typically considered a last resort for treating osteophytes and is usually only recommended if conservative treatments have failed to provide adequate relief and the pain is significantly impacting daily life. This means that all other non-invasive methods, such as physical therapy, medications, and lifestyle changes, have not been successful in managing the symptoms. The goal of surgery is to remove the bone spur and address any underlying joint damage. This can help to alleviate pain, improve function, and enhance the overall quality of life for the patient. Surgical procedures for osteophytes vary depending on the location and severity of the condition. Some common procedures include osteophytectomy. This procedure involves surgically removing the bone spur. It is often performed using minimally invasive techniques to reduce recovery time and minimize complications. Joint fusion. In cases of severe joint damage, joint fusion may be necessary to fuse the bones together, eliminating pain but also sacrificing some range of motion. This procedure is typically considered when other surgical options are not viable. Joint replacement. For advanced arthritis, joint replacement surgery may be an option. This involves replacing the damaged joint with an artificial one, which can significantly improve mobility and reduce pain. This involves replacing the damaged joint with an artificial one. The artificial joint is designed to mimic the natural movement of a healthy joint. The decision to pursue surgery is a significant one that should be made in consultation with a qualified healthcare professional after carefully considering the risks and benefits. It is important to have a thorough discussion about the potential outcomes, recovery process, and any possible complications. Section 10. Living with osteophytes. A focus on long-term management. While osteophytes can be a source of pain and discomfort, they don't have to define your life. The good news is that with proper management, most people can lead active and fulfilling lives, enjoying the activities they love. The key is to adopt a proactive approach that combines medical treatment, lifestyle modifications, and self-care strategies tailored to your needs. Regular checkups with your doctor, adhering to prescribed medications, and following their advice are crucial steps. Engaging in physical therapy as directed is essential for keeping symptoms under control and improving your overall well-being. By taking an active role in managing your condition, you can minimize pain, maintain mobility, and stay independent. This proactive approach allows you to enjoy a good quality of life. Remember, you are not alone in this journey. Many others are navigating similar challenges. Support groups and online resources can connect you with others who understand the challenges of living with osteophytes and provide valuable information, practical tips, and emotional support to help you cope better.